I think that's the one we're doing. So I believe that there will be a dialog box or something popping up asking you to acknowledge that this is being recorded. I believe it should happen. I don't see it on my screen, but maybe it has happened for others. The basic premise of this being that we are wanting to be very, very thoughtful and careful about what's known as PHI, which is protected health information. So obviously people are going to be talking about what's going on in their lives. Please know that this is a choice that you have. We are recording it. The recording will go onto our website for people to listen to, and I will send that link out afterward, and I will try to get it to everyone by the end of next week, Friday of next week. So thank you all for that. I would like to ask if we can scroll down to the second page of the agenda for a moment, where we have the ground rules and the expectations, the agreements. There we are. I'm not going to go through all of these, folks, but I want you to know, first of all, it occurred to me earlier today, those of us who have been attending these groups for years, it's easy to forget things that are not familiar with people who have been coming less often or who are new, which we really are glad about. These agreements were made up by stakeholders years ago, and the basic premise being that we are here to accomplish some things, to talk about things that people sometimes feel very strongly about because they are quality of life, or as some stakeholders have informed us, life and death issues, about staying in your home. CDASS and IHSS help people to stay in their homes as opposed to going into a facility. That's really important. So along the way, though, we're going to have some strong feelings. There are times when people ask things of each other, ask things of the department that we have to say no to for various reasons we can't do, or we can't do them now or as fully as people want. And sometimes people get upset about that, understandably. So I just want to ask people to give everyone a little grace here, know that we all have best intentions. We are not doing this perfectly. We are not always, stakeholders are not always satisfied. This is a forum to hear about that, but we do need to keep decorum and consideration. So if anything occurs in a meeting that is not that way, I'm gonna stop the action and bring us back to a point where we are respecting each other and being that way. So thank you for that. If you can scroll back up to the first page of the agenda. There may be something I'm missing with all of that I just said. I hope that Aaron or one of the team will fill us in. Okay. So now I want to find out, we do have the attendance link. I put it in the chat. It did mistakenly say January earlier today. Sorry about that. It is for April. In any event, if you recorded your name earlier with that, no problem. We're going to know it's from today. So I have Ron Heller and Tracy Heller down as being on the phone. Is there anyone else who is on the phone today? You can unmute your phone by pressing *6 and giving me your name.
Renee Farmer.
Thank you, Renee. Anyone else? I believe we might have Robin Stevens on the phone. I will follow up with her about that, and she is the one who manages our attendance record, by the way. Thank you, Robin, for doing that. Okay, I will come back to that. Now we're coming to the open forum, and let me just give a little introduction to that for those who are new. The open forum is a place that happens twice during the meeting. You'll see it twice on the agenda, and at 10 minutes each, up to 10 minutes if we need it. It is the time for stakeholders to make announcements. We used to have it as a place where stakeholders could make agenda topic requests, and that is something you can do. We also have a topic request form, which I believe one of our staff will pop into the chat, and that is a way for us to find out what people want as future topics in the meeting. It's a time for people to network with each other, to say if there's some information or something you're looking for. We don't really want stakeholders giving their phone numbers or email addresses to each other during the open forum unless you're absolutely okay with everyone, including the recording, knowing what it is. So those are the purposes for the open forum. Let me ask if anyone has an agenda item. If they want to say they have an item for the open forum, you can type your name in the chat for the open forum. I see Julie Riskin has done that. Thank you. Anyone else? You can unmute your phone, give me your name for the open forum. Anybody? Scrolling up the chat to see if anyone prior to Julie. Topic request. There we are. Thanks, Danny. Okay, seeing no other names. Anyone else other than Julie? Okay, I will turn it over to Julie for an item, and then I will go back and see if there's more names. Julie Riskin, please go ahead.
I think Adam had his name in there before me.
Oh, okay,
Julie,
well.
awesome. It's all good. Thank you, Julie. I appreciate it. It's no worries.
Go ahead, Adam.
Well, hi, everybody. This is Adam Markert over at Consumer Direct. I just wanted to take this time to say I was really looking forward to introducing today a new member who's taking on my previous role of FMS and Case Manager Coordinator. Her name is Jo Myers. It had to text me this morning at about 5 o'clock to say she has what almost everybody else in the state has, and she's not feeling well. So I look forward to introducing her to everybody at our next meeting. Just wanted to apologize. Some people were looking forward to that today. Cheers.
Thank you, Adam. And okay, Julie Riskin.
Great, and I'll put this on the form too. It's just an issue that came up of people being able to, when someone who's the CDASS client dies, particularly if they die suddenly, it's come to my attention that that people are not able to use their accrued sick time, and the language or the documentation and the rules says something about when you leave your job, you're not able to take it with you. But when someone dies, they're not leaving their job. The job is leaving them. So I want to get that changed. I think that's not fair to the workers that, you know, that work really hard for people to not be able to use the sick time that they have earned and that they are entitled to. So so I just wanted to say that, see if anyone else has any feedback, and that I will be putting that on the agenda.
Okay, Julie, thank you very much.
And
like
one
had...
other, yeah, one
Go
other
ahead.
issue that I learned about, which is kind of horrifying to me, is because welcome, Brandon. I'm so happy you're here. Yay. I just saw your chat. Is that another thing is that apparently people who are family caregivers who aren't paying the taxes cannot get unemployment. And I don't know if there's a way we can have them pay into unemployment, because they're not paying for it. So I understand why they can't get it, but they're not paying in. Is there a way they could pay into unemployment? Because especially when they're a family caregiver, that's really traumatic. It's like you just lost your family member. Now you've got to go get a job in a week. Like that's really awful. And so I think we need to change that. And I see what Robin says in the chat. I don't know if that's a state issue that we need to solve or a federal issue, but we need to fix this, even if it's some kind of state-only program for folks, because people should at least, especially family members who, you know, I mean, other caregivers can go, you actually could go get another caregiving job pretty quickly, because there's so many of them. But so it's out. I don't know if it's a law or regulation, but we need to fix this. This is a huge, it's really unfair, I think, and cruel to people.
Okay, thank you very much, Julie. Looking at the chat, is there anyone on the phone who has an item for this open forum? We still have a few minutes, and you can unmute your phone by pressing *6.
Hey, John, this is Sandy. Julie, to that question that you just brought up about the taxes, those are state and federal tax laws, and it has to do with the association to the individual as the employer. So this isn't a specific program rule. This is a state IRS rule as defined by the defined by the IRS tax code.
So federal, then not state.
It's both federal and state. So it just, you are exempt from having to pay into both federal and state based on,
Can someone choose to just pay in, to just say, I know I don't have to?
no, they can't.
So you would really, to get around this, you would need a second address to say, all right, I don't really live there. And then you're not eligible for it, right?
Or you can change who holds the EIN. So you could still have difficulty of care and live with the individual. What you're talking about is state and federal unemployment and social security. That has to do with who holds the EIN number. So here, I'm sorry, I forgot to go on camera. So if that makes any sense, I'm more than happy, Julie, to set up a time and talk you through it, you and Robin, just to.
Yeah, because I'm totally confused about why because the EIN is based on either the client or an AR. It's not based on the worker.
It's based on the relationship to the worker then. So for instance, and these are laws that are put in place so that if, two people own a company, they're the EIN holders or there's a spouse, they can't keep laying off their spouse to collect unemployment and vice versa. It's just it's a check, and I can walk you through the IRS language is a great topic to bring up. It's something that I've always been concerned about because there are individuals that have that exemption.
Andy, this
Yes.
is John. Let me ask if at this point, maybe the two of you can take this offline
Sure.
some other moment. But I think that if Julie was asking this, obviously other people will be asking, and if maybe some information can be shared at a future meeting, even if it's just a handout, that would be
Sure.
super.
I'd be more
Okay.
than happy, Julie, to work with you on that.
Thank you. We have time for one more, I believe. Robin Bolduc, you have your hand up.
Yeah, I'm trying to get rid of the audio here. Yeah, I was just piggybacking on that because it happened to me. So when my husband was hospitalized for several weeks, I applied for unemployment and was told that, and it's specific to spouses and minor children. And it's an actual Colorado rule that says that we're not eligible for employment. Based on relationship. It has nothing to do with CDASS. It has to do with I'm married to my boss. My idea was, and we can talk about this, please include me because it's a huge issue, that we modify the Colorado law that prohibits it to include CDASS spouses. I think it's an easy fix. At least at the Colorado level. I'm not sure how it interplays with IRS though.
Okay,
And-
thank you, Robin. Let me ask if y'all maybe we can circle back to this next time, and perhaps this conversation can pick up with the three of you or something. Would that be all right?
Yes, that would be perfect.
All right.
So why don't we get
Yeah,
together and make a report next time? Could we have that on the agenda then?
Well, I believe that if you're making a request for that, we'll get that request. If you can use the topic request form, that would be really cool.
I just did.
Okay, there we are. It has been requested, so thank you. I will move us to the next item, and with a bit of an apology, I was going to have this in writing, folks, and it's been my mess up a bit. But this next item that's on the agenda, stakeholder co-chair duties, is something that I have talked with Kevin and Kurt would be on here. And it's simply to say that for a meeting that has been going now for 12 years, where there over time has been a little bit of evolution of the duties and role of the stakeholder co-chairs, it's something that might be a bit, unfortunately, invisible to people who are newer or people who don't attend that often. But there are duties, there are roles that are laid out, and this is per stakeholder agreement of the co-chairs. And one of them, one big one, not the only one, is for them to interact with the department between meetings to talk about what happened at the meetings, what topic requests are being made. Now we have a more formal way that people do that through that link, but not everyone has internet, so we do get them otherwise. And to talk about how we should use the time at future meetings, whether a given topic, for example, can be handled in May, or whether for some reason we have to wait till June. Also, stakeholder co-chairs have been involved in the development and vetting in terms of just like, you know, typos and just going over something, the written document of the written recommendations that get put together and then vetted by the group and then eventually voted on by stakeholders. So those are stakeholder recommendations to the department. And the other thing I want to say is that the stakeholders have always been in that role through a voting process by the stakeholders, and that's one of the uses of the voting rights, which, by the way, are determined by stakeholders and sort of monitored through attendance. And that information is on your agenda. I think it's on page 3 of the agenda. So when you have a chance to look at it, that might be really good if you're not familiar with it. We had a recent question by someone, a stakeholder, about having an extended absence due to health and how that affects attendance. And I referred that person to Robin Stevens, who is the person who manages the list. And if she has any questions, she can certainly consult with the stakeholder co-chairs, Kevin and Kurt, or Kurt, both of whom have been with the group for a long time. So again, attendance, voting rights, those are not things that the department makes decisions about. We don't determine which stakeholders do and don't because they have to do with voting rights. So those are the duties. I will get them in writing and send them out as a handout in advance. I'm going to run them by the co-chairs between meetings to make sure that they're correct, and then run them by the group so that, and we'll put them on the web page. So we are a bit ahead of schedule, in fact, quite a bit. So do we have someone with us from the Community First Choice team?
Yep. Hi, John. This is Christine DeSantos.
Perfect. Hi.
Hi.
Okay.
Hi, everyone. Christine DeSantos with the department. I am going to just give a brief summary or overview of what the CDASS CFC work group discussed last month. We had a meeting on April 19th. We had 20 people join us for that meeting, and our topic was training. And the work group reviewed what current offerings our training and operations vendor, CDCO or Consumer Direct of Colorado, offers our CDASS members. And we discussed what's working, what's not working, and maybe what's missing from current CDASS training. And the work group also discussed how ways that the department can increase participation in CDASS training. And we got feedback. We got really great feedback from the participants in the work group. Some of the feedback included improvements to case management training. So more time and information on those tricky topics like skilled versus unskilled, the utilization review, utilization management, URUM, process, extraordinary care, and protective oversight. They also talked about making training more accessible. And so having trainings available in and support for non-English speakers, including Spanish and other languages, as well as providing training in a variety of formats that are more accessible. So that might be, that might include on-demand videos and audio, and also concepts like what we're hearing about micro-learning. We discussed expanding training in areas such as finding workers, kid-specific issues, and aging caregivers. There was a request for increased community outreach. So basically reaching out to community members that maybe aren't aware of CDASS as an option, that being like hospital discharge planners or social workers. And we discussed the possibility of offering a support group where members could learn from each other through shared experience about difficult topics or areas that they are having some struggles in with employment, being an employer. And then lastly, we discussed, looking into newer concepts and opportunities like new technologies that might be available to employers, which might include things like scheduling apps. So all in all, we had a really great, robust conversation about, just ways that we might be able to improve or bolster what we currently offer through our training opportunities. And our next meeting is scheduled for May 17th. From 1 to 2:30. If you're interested in attending and you haven't already reached out to the department to get that invite, you can reach out to me by email. I'll put my email in the chat as well.
Okay, do we have any questions or comments for Christine? If so, you can give me your name for the queue. I'm looking at the chat to see if anyone typing their name in. And by the way, I'll just take a quick moment here. We also mentioned that people can raise their hands in the webinar. If you're not clear how to do that, you can go to the bottom of your screen. There's a little button for reactions. Click on that, and you can do a number of things in there. But one of them is you can raise your hand in the webinar, and then if you change your mind, you can also go there to lower your hand. So people have asked about that. It's a little two-step process. So anyone? Questions, comments for Christine? Okay. Seeing none, hearing none. Christine, thanks. So now we are on to item number 7 already. My goodness. And Kurt, Kevin, is this something that one or both of you can take over? Looks like.
Hello, Kurt here. Sorry about that. I had to try to unmute.
Okay.
I don't know, is Nathan on here? Nathan, by any chance?
I'm looking at the list. Let me see. I do not see his name in the webinar right now.
Okay.
Kurt?
So real briefly, well, I'll just kind of update what Nathan has proposed. And he had a pretty big, well-written proposal about it. And that he felt, and I think the idea is that authorized reps actually do quite a bit of work. Some of it naturally, a lot of times as family members. And while I can certainly understand where an authorized representative, it could be a conflict of interest if they know the budget and get paid and set pays. His thought was to set aside some of the allocation for those duties that an authorized rep typically does, whether it's approving timesheets, interviewing, hiring people, placing ads, or even just doing the care. He was kind of feeling there should be some stipend for that to manage that, whether it's a max or whether it's a dollar amount. And I'd just like to open that up for discussion. I know there's quite a few authorized reps. Julie, I know you handle about 5 or 6 people. It's a lot of work. And then while we certainly like to volunteer and help people out, it's a lot of work. It can be a lot of hassle. So with that, I'd like to open up the floor for a discussion regarding that, if that works and what thoughts and ideas would work. Any questions for anyone?
I just typed in the chat, Kurt, asking if anyone has any. They can type their name there. They can raise their hand in the webinar. I see Robin. Julie will get there. Anyone on the phone who wants to add their name to the queue, you can press *6. Okay, waiting for that. I'll check again. Looks like Julie, you're first. Go ahead.
Yeah, my initial reaction to this was negative and concerning, but the more I've thought about it, the more I think this might be a good idea. I think we'd have to have a lot of guardrails because I still think there is the risk of conflict and abuse, but it is a problem recruiting authorized reps. And I know I've had to say no to a number of people just because I don't have, because like you said, I already do a number. And I think for people that don't have, it might be a good way for people who don't have a job, like a full-time job, to make a little bit of money and do something that is desperately needed, because as we all know, there are a lot of people right now that particularly who have high care needs. And the high care needs are the ones where it's really a lot of work, who can't get care any other way other than CDASS. So so I think it's, and Cheryl just put in the chat, do ARs go through a background check currently? To be honest, it's been so long since I've signed up, I don't remember, but I don't think so. And that might be something that we would want to institute, you know, because I think there is, again, I think there'd have to be some guardrails, because I do see some like risk for abuse, which we don't want in this program. But I don't know, I'm certainly striking out with people being willing to do it. And it is the only way to get care in a lot of the state. So I think it's, if I don't know, I'm just starting to warm to the idea of, I thought they were talking about it for care, but I think it for actually the AR duties, that feels a lot better to me and more reasonable, because then they can do their job and get the care in, and they actually could budget the time to do that. Because so anyway, I kind of like the idea, but I do think you'd have to have a number of guardrails.
Okay, Robin, any other comments?
Yeah, I was on a call with CMS. I think Jessica was on with me and I asked this question. And CMS is saying that if I remember right, and maybe Aaron or whatever, I think some of this is a CMS issue. So they definitely can't be paid for care. I remember that part. If we divide out the care from the administrative tasks, I'm not sure. I think the first question is to ask CMS whether or not it's possible. But the care part, they were absolute on the no. My other thought is, and I'll just keep pushing this, is some of this support broker could be taking over and making it less onerous for the AR. So there's that. And my other piece is I think AR should go through a criminal background check no matter what we do with it. So.
Yeah.
Thank you, Robin.
So,
Oh, go ahead.
I just
Sorry.
want to add, this is Kurt. I just want to add that until very, very recently, I agree. I was pretty dead set against an AR getting paid. I just don't believe that. I just believe there's too much opportunity for exploitation and abuse there. But I do think with the proper guardrails, maybe a limit dollar amount or things such as that. A great example, I was stuck in bed for 4.5, almost 5 months. Really had to use one of my caregivers because I can't move my arms to actually approve timesheets and things like that. So it's difficult at a certain point where you really need to have an authorized rep or you're very limited. So I think that's something we should really consider, even if it's just a stipend at some point for the administration duties. Any other comments on that? I'd like to be able to discuss that to the point where Nathan did actually have a proposal written up regarding that, and wondering if I can get Nathan to resubmit that. It's pretty lengthy, but wondering what the thoughts were of the rest of the group, if we can clarify it up with the idea of having managed guardrails, maybe a maximum stipend amount, and background check, of course. Any other thoughts on that?
Like Aaron's
Oh.
been in the queue, so, and then
Go ahead,
after
Aaron.
she's done, for more names. Okay.
Well, hi, everybody. Long time no see. First, I just want to say we have a snow day, so if my children bust into this meeting, my apologies in advance. So first, I want to share, I hear you. Authorized representatives are hard to find, especially as a volunteer position. In CDASS, it's a lot of work. It's required for kids in IHSS. And so I think there's definitely a concern about, like, how do we get people who are qualified and who can do this and who also don't mind doing it for free. Like it's going to be an issue, I think, for a while. But I want to just speak to a couple pieces here. There was a House Bill 23-1203 that was introduced, and I think it got pulled, but essentially it was looking at paying parents to be the authorized representative as well as a caregiver. And so that's not possible. And we worked with a couple of folks on that bill. It's just not something that we can do. But on a larger scale, if we're looking at paying authorized representatives, there are federal prohibitions that we have to adhere to. And I'll just say, as we move into community first choice, there is very strict guidance that an authorized representative cannot be paid. So that being said, I think you all are really creative people. And if you have other thoughts or ideas about how we might get to push this around, again, our whole thing is, for right now, it's not something that's possible. So if we get a recommendation, it might just be that us saying that, it's federally prohibited. Doesn't mean that that's right, or I agree with it, or that you agree with it, but hopefully that might help a little bit more.
Thanks,
Okay,
Aaron.
so
Anyone
John is
else?
asking, put anyone else in the queue? Sorry, John.
No, that's okay. No problem.
Well, with that said, I'm not sure if we should approach it, even sending a proposal. Again, Nathan's not on here, so I'm not exactly sure how we proceed on this. But any other last thoughts before we're ready to move on? And I don't see hands raised or anyone. All right, and I did see Rita said, first off, doesn't the AR have to know the client at least 2 years? And I believe that is true, yet they do need to know them at least 2 years. So you got to have someone who's not going to be, they have to have a vested interest in what's going on. And then I see Robin wrote here, the CMS rep on the call was adamant that it was a no for them. So it sounds to me like this might be something not worth chasing just based on what CMS is allowing to do. So with that, I think, Kevin, are you there? If you got any comments, but I think I'll talk to Nathan, and I know and let him know it's sounding like this is a no, partly because CMS is very clear that our funds will not pay for that. And with that being said, I'm guessing that the state won't pay for it either unless they amend something. But Julie, any comment on that? Julie Reskin?
Robin was the one that was on the CMS call, so I don't have any comment. I have not researched this, but Robin might have a comment.
Okay, Robin, any more thoughts on that?
Sorry, I walked away a second. Yeah, I guess I had kind of laid it to bed because of that call. And like I said, I think Jessica was on the call as well. I could look back in notes, but she was pretty no. Certainly as a caregiver was an absolute no. And again, I'll push that if we move to a support broker, if we call it something different, a support broker can take up a lot of those responsibilities and be paid. So if you make it it can be, and again, I'm sorry, Jessica, help me here. A support broker can be a separate benefit, or it can be kind of a sub benefit, and how it's paid that's where it gets complicated, whether it's paid out of your monthly allotment, or it's a separate benefit and it's paid through a separate funding source. And those are all the questions about support brokers, which is why I've been pushing them. I don't see it on the agenda again. And maybe it's a subgroup, God help us, looking at what all those alternatives are, and does it address this issue.
Okay, thank you, Robin. This is John, and I just want to make a little point about how we run these meetings, which is to say that a number of people, and it's great, have typed comments in the chat. In this meeting, first of all, we have some stakeholders who are not online, and so they won't be able to read those. And we are not, unlike other meetings that OCL does, we don't read out all the comments in the chat. So if you want to make sure that everyone in the meeting is hearing what you have to say, you really should get in the queue and get, on the mic and speak out those comments. So with that, looks like Aaron is in the queue. Aaron?
Thank you. So I'll just make a quick comment to Robin's point about support broker. So this has been a conversation we've been having in Community First Choice. And so that's something we're looking at incorporating into the new RFPs and INA services. And please help me, someone, information and assistance, I guess is the official term. But we are looking at doing that. And what that looks like is still kind of in the works. But, we can be creative, guys. And even though CMS has definitely said no on this, I think it's my personal feeling that we are pretty progressive here in Colorado, and there might, who knows, there might be a way to figure this out.
Okay, thanks, Aaron, and everyone. Thank you, Kurt. Oh, we have more?
So this is Kurt here, one last time. So with that said, Aaron, I'll talk to Nathan a little bit on it. I love the idea that we can maybe go through a support broker on it and be creative. With that, I'll get with Nathan and we'll carry the ball and see how we can proceed. All right. All yours, John.
Sounds great. Thank you, Kurt. So we again are running about 20 minutes ahead of our schedule. Next up is the item by Jessica, high-risk crimes list for CDASS.
Hi, everyone. Jessica here. I just wanted to walk through the CDASS background check crimes of high risk employer guide with you all. As a reminder, this was provided through the, and if you would give me just one quick second, I apologize. Okay. This was provided through the PDPPC materials that went out via email and snail mail. So you each should have gotten a copy of this. It was also provided as an attachment to an operational memo that was posted recently to the department's memo series webpage. This is the process we've taken when what was formerly known as the barrier crimes list has been updated or changed in any way, just to get the word out so everyone, including case management agencies, are on the same page and are aware of what those exclusions are. So I'm not going to read through these initial 3 paragraphs, but I will just highlight a couple things, which is that there obviously is the requirement of the financial management services contractors to run those background checks for prospective attendants. And they're looking for initial eligibility. And I say initial eligibility because, as many of you know, we have developed an exception process, which I'll speak to in a little bit more detail in a minute. An eligibility is determined on 2 levels. One, does the individual's background check report, which is pulled from the Colorado Bureau of Investigation, demonstrate that they've been found guilty of the particular charge, or if there's information missing, and specifically crime class, an offense date, or a disposition, then that will also flag the individual as initially ineligible. We've included some links in the document to direct people to our participant directed programs website, which has more information, and we'll soon have a lot more information about the process, including the exception process, as well as a link to the online form where people can request those exceptions. As with anything online, there is the availability to make an exception over the phone, walking through it with me or someone else from the team. And in order to do that, you could just call our new PDP phone number, exciting times, 303-866-5638. I'll repeat that at the end of my little presentation. Okay, so moving along in the document to how to read the document and kind of understand it as a tool, you'll see that each row contains the crime class categories. Many of you know that individual charges that you might see on a background check report could get more descriptive. It is really up to the presiding police department, or I think even officer, to determine the information listed under charge on a background check report when they're filling that out upon an arrest. So these are the categories, and our FMS are looking initially under the not initially eligible for hire row column, excuse me. And so we can see that felony drug offenses is on here, and it has remained from the prior version of the barrier crimes list. Felony fraud within the last 5 years, felony theft, abduction or kidnapping, hate crimes within the last 10 years, felony arson within the last 10 years, neglect or abuse by a caregiver, any violent felony, child or at-risk person abuse, neglect, or exploitation, crimes against a child or at-risk person that causes harm, felony involving an act of domestic violence, sexual offenses, healthcare fraud, purchase or sale of a child, sexual exploitation against a child or at-risk person, and murder or homicide. And you can see that there are some footnotes in this document that'll take you to the state statutes for anyone who is interested in learning more about the crimes associated to these categories. So an example that might come up is felony theft. That's one we do see quite a lot on background checks. If a person has that on their background check report and a disposition of guilty, PPL or PALCO will find that person initially ineligible for hire. Now, if the employer still wants to hire that person, they trust them, they need the help, they can request an exception. And as long as that disposition with the offense date is from 5 years or longer ago, that person would be eligible to be hired through the exception process. If it happened last year when they were found guilty, unfortunately, they would not be eligible for that exception. Similarly, if the report did not have a disposition, so it was not clear if they were found guilty or not, the FMS would still find them initially ineligible. And when an exception is pursued, the lack of that disposition and the lack of clarity around it, the outcome of that charge means that the person would still be eligible for an exception, because we want to highlight that it is conviction within the last 5 years that exempts that person. I think that's about everything. I know that this has been a long time coming. There's been a lot of work that has gone into the process of just updating this list and thinking really critically about what that balance is, what that balance should be between keeping members safe and their well-being protected, and addressing the fact that we need caregivers and we need to encourage and support individuals who want to be providing that care to CDASS members. And so we hope and think that this is a good approach and that it balances Our ultimate goal with the work group of creating some opportunities for choice and flexibility while still keeping health and well-being at the heart of it. Pretty soon, if not already, and Adam might have to correct me, there's a number of resources that are going to be available to any person who's interested in looking at them, but particularly CDASS employers, that will help walk a person through how to read that background check report, how to have particular conversations with individuals about their report, where to go for additional resources in the community, and including kind of the research, the reports that the work group did to help initially get this work going and start thinking about these questions that we tackled. Again, the exception process is something that the department is managing, and we would prefer if individuals who wanted to pursue an exception would fill out the form online, but if that is not accessible to you, then reach out to us. You can email us at hcpf_pdp@state.co.us or give us a call at 303-866-5638.
It looks like Julie has her hand up too, so she might have a comment.
Danny. Go ahead, Julie.
Yeah, I have a question. So I guess I thought that it was going to be that this list, there'd be an automatic eligibility and that the exception could be really for anything except what you're not allowed to do by federal law, which is the fraud thing, the Medicaid fraud, where you can't ever participate again. Because this, like, again, sexual offenses, like it doesn't take a lot, quite frankly, to get a felony on a sexual offense. And sometimes it's like real, like it, one example is like some guy is with a girl and he thinks she's over a certain age and she's not, then the parents find out. I was talking to someone recently and apparently even like public urination, if you're homeless, can be that. So even though like you hear sexual offenses and it's like, oh my God, you don't want a horrible person like that around our people. It's not that cut and dry. And the same thing with like, getting convicted of like at-risk person, whatever, there are people that are, again, horrible people and shouldn't be doing this, but they're also, sometimes those things happen due to retaliation or something that really isn't abuse. So I am concerned about this bar. And also I think unless there's like a federal law, like there is with the Medicaid fraud, if it is an Olmstead issue, if this is the only way the person can stay out of the institution, the state still has to make a modification of their policy, practice, and procedure, unless doing so is a fundamental alteration of the program, service, or benefit. And I don't think just saying there's a policy would rise to that level. I mean, the Department of Justice certainly doesn't think just saying so rises. So this could be like the guideline, but I just want everyone to know that you could still ask for an exception under Olmstead if you can show that this person is needed to stay out of an institution. It can't just be because you want under Olmstead. But I guess I didn't realize it was like this strict. I thought we were trying to open this up more because of our caregiving crisis.
Yeah, thanks, Julie. So a couple things. I think it was in February. I can't honestly remember everyone, but part of the update that I had provided a little while ago about the status of this process and the list was to say that we had to work with CMS to update the waivers, and in our collaboration and dialogue with CMS, they gave us feedback that I won't get into the details because that would keep us here for a long time, but essentially had to resulted in us having to kind of walk back some of the flexibilities that we originally
So you're very
created.
politely and nicely saying CMS got in the way of doing what we wanted to do, but I know you can't say that, but.
Well, I think they made some good points, and we definitely were not going to put any of the waivers at risk. So we really did think thoughtfully about what was going to end up on the final list. And I think your example of what would I think be indecent exposure is a good one. When going into the statutes to at least get the references of where they live in statute, we looked for that. And so indecent exposure in almost all situations should be a misdemeanor. And we kept that kind of thing in mind as we were thinking about the exception process. So I can say that we've had a number of exceptions requested, and I don't have the figures off the top of my head, but I can confidently say that almost all of them can be approved. So so that tells me two things. One, those individuals pre-exception process would not have been able to work. And so this new approach is working in that regard. And I think it helps that we're not just making the decision as a, kind of flippant, oh, someone needs a worker, let's let them hire this person. We're really taking a look at the situation and asking ourselves about safety. That safety planning document is getting filled out, and I've seen some really thoughtful responses from people on that. The case manager will be looking at that quarterly when they check in with a member. So I think there's a really robust framework here to again, keep that health and well-being in mind, get a little bit more oversight, frankly, into the process, and still increase the availability of caregivers through our hiring process.
Thank you.
Jessica, I did ask for other names for the queue, and no one did respond in the chat. Is there anyone else who has a comment or question about this? Or Jessica? You can raise your hand in the webinar. You can unmute your phone right now. Give us your name. Okay. Hearing none right now. Jessica, anything else?
No, I'll just say it again, it was a long process, and I do really want to thank everybody who's been a part of it, including this PDPPC group, when we've brought it to you all to participate and give your feedback. So thank you.
John, can I just say
All right.
one thing? This is Kurt.
Go ahead. Sure.
I just want everyone to acknowledge that Jessica did a great job on this. Spent a lot of time on this and making things happen for people. So again, Jessica, for me and everyone, thank you for all your hard work.
Okay. Thanks, Kurt. We can have the agenda back up on the screen. Be good. There we are. Thank you. So it is now 1:56. We have, as you all can see on the screen, or if you're on the phone, I'll tell you, we have a short meeting. It's scheduled to wrap up at 3:05 if we cover everything, which we are committed to do. So I have a question mark for the break. Seems like we just got started. We haven't even been meeting an hour, but this meeting will probably be a 2-hour meeting. We can take a break or not. And I will just ask if anyone in the group would be okay with skipping the break for now. Perhaps looking at after the breakout rooms. Shall we proceed? And obviously including the co-chairs. Kurt, Kevin, any thoughts about that group?
I'm fine with skipping the break. I mean, let's keep it moving. Got a great meeting though moving. So unless anyone else has any issues.
Someone in the chat said skip, they're agreeing with that. Okay, I'll move us forward. That brings us to the breakout rooms. I will turn it over to the staff who are getting that organized.
John, may I just make a little request? Since the breakout rooms are usually a set time, we've got people who only come for that. So being ahead, I don't want to miss people. Could we perhaps move the subcommittee and work group report out up?
We sure can. I believe that one of the subcommittee report outs will occur after the breakouts because that group meets during the breakout time. But we can
Okay.
do all the rest.
That would probably work. Okay.
So, okay, let us go to item number 11 then. And Danny, I think you popped that screen up. Sorry, thank you though, and we'll come back to that. The first subcommittee work group report out has to do with expanding CDASS, and it says co-chairs there. So Kurt and/or Kevin, you want to lead this off or give this report out?
So I'm here. Kevin, are you there?
I don't believe you guys can hear me.
I can hear you now.
Oh, there we go. Yeah. I don't have anything to add to the CDASS expanding on expansion. In IHSS, there's nothing to report on that.
And I can't remember exactly what we talked about regarding expanding CDASS. Aaron, do you remember any? Oh, I remember. Part of it was, did we get clarification on caregivers giving care while you're hospitalized? I don't know if that was part of it or not. I know Robin, you and I talked about that quite at length. And I think even according to the CMS says no. However, because of COVID, it was yes. So I'm not sure if that was part of the expansion of CDASS or not. Does anyone recall that discussion?
Hey Kurt, this is Erin. Regarding, so I think there are a couple things going on. So I don't want to speak over other folks in the group, but regarding the recommendation for CDASS and IHSS while a person is hospitalized, we did submit our response to the recommendation, but we're still in communication with CMS on this. So once we conclude those discussions, we will come back to this group and let you all know where we're at if there's a different outcome.
Right. Daniel, you had responded on that originally, right? Is Daniel on?
Yep.
Danny?
Yep. Yeah. Originally, yeah, we did provide the response to that. It's 2 PDPPCs ago, I believe.
Right.
Yeah. But I think I do see Oliver had his hand up and then Robin, and I think they might be able to speak to the expanding CDASS piece.
Okay, Oliver, go ahead.
Hi, thanks, Kurt. Yeah, I think what they're talking about, and I know a lot of other states do it, is they like if we have it's for self-directed care, and so we have like our if you're in CDASS, you have an allocation. Well, there are a lot of other states that do allocation for goods and services. They do allocations for transportation. I know there's some interest right now. There's a waiver, the complementary and integrative health waiver. Some people are really liking to look into getting self-directed, an option for that, so you can have an allocation and self-direct your own care. So I think that if my understanding is correct, or my memory, the expansion would be talking about increasing allocations for other things like goods and services, transportation, complementary and integrative health, and things like that. And so that's what I think the ask was for.
Now that I think about it, you're correct. It was kind of going back to what in the pilot program, I know they have what they call the funds for additional services. And it's basically, I believe, from what I remember back in the day, if you had unused funds at the end of your allocation, you could spend half of it on certain items, whether it was to make your life easier, like a microwave or a dishwasher, or or ramps or things like that. But I really like the idea, and I think Robin mentioned if that some other states take and kind of instead of that money just going away goes into kind of a pool, then you can request those additional services. Such as I know that it used to be the SCI waiver. I don't know what they cut CCH now or something like that now. So whether it was integrative services like acupuncture, massage, chiropractic, things like that, where maybe they don't get it where it would be necessary. So with that said, I'm not exactly sure where we go from here on it, other than we need to have a subgroup to see how we can maybe make this as a proposal and move forward with something like that.
Sure, we have Robin in the queue, perhaps. I think she's had her hand up for a bit, so.
Sorry, I can't see it. I can't see her hand in the queue. Sorry about that.
Oh, hi, Kurt. I was actually on a phone call and caught my name. But so there's actually two separate issues from the conversation I'm following. One is the hospital issue, and that is being followed up on. The Colorado Hospital Association is involved and are supporting our position that CDASS attendants should be allowed in the hospital. So right now it's back in the hands of HCPF to look at what is CMS saying. Colorado Hospital Association says it can be done. There are other states that are doing it. It may be some sort of kind of administrative glitch about how we provide those CDASS services, and CFC may actually make it easier. So it's a complicated issue, way more complicated than it looked on the surface. The other is expanding CDASS services. So yes, again, and Oliver and I sit on committee. In other states, in some states, there's a separate benefit called other goods and services, which is funded separately from a CDASS kind of model. And in other states, which we originally had, is any leftover funds could be spent on other goods and services. So there's really two options, and it's funding mechanisms. And I'm not quite sure which is better. The other goods and services in some states is kind of really loose in that it's whatever you need to be more independent in the community relative to your disability. So it could be air conditioning, it could be buying, Alexa products. It could be anything specific to you and your disability. So there's that. And then there's expanding consumer-directed options such as transportation or housing modifications. So expanding CDASS takes on, it's a very broad term. So my thought was we need to narrow it down to what we're talking about. And I think let's pull the hospital issue out, because I believe that's separate. And then looking at, are we going to expand a benefit we already use, like respite, like transportation, like housing modifications, and turn it into a consumer-directed model? Or do we want to actually add a new benefit that's called other goods and services? So that's my question, probably thrown out to the group. Or do we want to do both?
John, does anyone else have their hand up, or anyone else in the queue?
No, they do not, Kurt, and I think that I would caution us against getting into a more extended discussion here about it, not to say there ought not to be any. This is important, but this was like a quick report out item, and we have other items here in this agenda, so perhaps this might be a topic for another time as well.
Real good. What I'd like to do is, I know, so I just want to end with, I know Robin and Oliver, you guys are involved in it. I'd like to maybe have you two, and if you wouldn't mind, joining me in a subcommittee on this to discuss that and how we move forward with it a little bit more, other than just kind of chit-chatting it as a report. If you wouldn't mind, I'd appreciate being on that committee, all right? Okay, I'm gonna
Okay, thanks.
assume we can have a little subcommittee on that. Thank you, John.
All right. I am looking at the bullet list here, and I believe that we covered the CFC item. And the URUM is up next. IHSS will be discussed after the breakout. Is someone going to talk about UR and UM?
Hi, John, this is Danny, and I will speak to this. So I don't have much of a report out today, mostly because I'm hoping to better understand what's going to be most useful for this group. During our last planning session, there's some conversation that evolved surrounding that maybe reporting out on stats might not be the most helpful for this specific group. And so I wanted to touch base with everybody here, since we have a larger group of people here, to better understand what's helpful in the realm of utilization reviews, utilization management, to find out if it's still helpful to have updates regarding Telegen reviews, or if maybe we feel like things are going okay with Telegen and maybe this isn't a topic that needs to be continued. I really wanted to get input from the group, and then I can work accordingly there. I can either open it up now if anyone has any comments, or you can call me or email me if that is your preference.
Are there any quick comments or questions then for Danny on this? You can type your name in the chat.
Robin, I see you say that you want Telegen info. Can you just clarify on what information is helpful and what information you want? Or I can reach out to you separately too.
Okay, anyone else have a question, comment for Danny on this? Obviously, the invitation to also email her, communicate otherwise. But for the moment, anything? Oh. So the person who texted, or it was in the chat before, was Robin Stevens. And Robin, do you have something you wanted to say about this topic? You can unmute your phone by pressing *6 or follow up with Danny separately.
Oh, no, I was just clarifying it was Robin Stevens that had the question about Telegen, and it looks like the question is about how long they're taking and how many reviews they're doing.
Okay.
This is David. I think it'd be helpful to know not just how many they're reviewing, how long they're taking, how many are denied on the first step, how many get approved after reconsideration, and where does Telegen see the biggest issue for information that's being submitted to them by case managers.
Thank you. Sorry, I'm writing this all down.
Okay, thank you, David. Anyone else? Well, I will move us forward, if I may. And again, Danny had offered to be in contact outside the meeting with folks. So I'm sure you can, Danny, leave your whatever contact information you want to give in the chat, or if you wanted to say something right now about that before we move on.
Yeah.
A phone number or?
Yep, I can say it now for those who don't have the chat. If you want to give me a call, you can actually call the Participant Directed Programs unit phone number, which is 303-866-5638.
Thanks a lot. So I'm looking at the bullet list now, and Jessica, I think NCAPS is up next, and then after the breakouts, we'll do the IHSS subcommittee. So do you want to speak to NCAPS?
Yeah, thanks, John. So hi, everyone. Our NCAPS update is a bit basic this quarter. As a reminder, NCAPS is a project and a group that several of us are a part of. NCAPS standing for the National Center for Advancing Person-Centered Practices and Systems. It's been, I think, almost a year that we've been working on this project, and it'll go until September, so we're on the tail end. In, I believe it was January, we shared that we were working on an outreach project in which all of us on the team were going to do some cold calls throughout the state to facilities that we wanted to better understand to what extent they were aware, they and their staff were aware of CDASS and IHSS, to really suss out gaps in knowledge, gaps in an understanding of the process to get people directed who are eligible and interested in CDASS and IHSS. So we completed that outreach and we're really successful. I think we were able to make contact with between 30 and 40 different organizations. So we have a number of point people across the state who we will be working with to move into our next phase, which is working to develop some kind of resource that really helps to educate individuals on participant direction, a little bit about the process to enroll, work with their case management agency, and get them better set up as they start what is sometimes a long journey to getting into eventually CDASS and IHSS. So more to come, but we appreciate the opportunity to be part of this national project, this national organization, and hope we're able to share something really exciting with you all later this year.
Okay, thank you, Jessica. So we will now move to the breakout room portion of the meeting, and the group breakout room dialog box is still open on my screen. So folks, you can choose a group to be in. We have 3 of them: members, families, advocates only. I will stop there. I think Danny's going to talk this over. Sorry.
No, you're great. Jessica actually got the screen popped up here for the breakout rooms, and you were on the right track, John. Got members, families, and advocates only, IHSS, or the FMS training and case management room. And if there's anybody on the call who's calling in and would like to be assigned, you can unmute and we can assign you to a room.
Renee Farmer, members.
You got it, Renee. What is the last 2 digits of your phone number?
62.
Thank you.
This is Jerry. I don't see any way to join a breakout room.
All right, Jerry, let me look for you here. What room would you like to be in? And I can send you.
The members.
Okay. Sending you now. Robin S., what room would you like the members also? Okay, sending you.
Hey, Danny, did I miss it? Where
No,
is
we're going
room
into
selection?
breakouts right now. Here, Sandy, I can just send you over there.
Okay, and then Suzanne, send Suzanne Crisp too, please.
You got it.
Thanks.
This is David, IHSS.
Ready?
Evan Smith, are you still with us? I see your name in the list there.
Yeah, I did not. I need to go on the IHSS as well.
IHSS.
I sent
Okay.
him. Sorry, I got a little click happy and I sent him before you could respond, John.
Anyone else who hasn't joined a breakout room, if you're having trouble doing it, you're not alone by any means, and we'll be glad to pop you into a room if you'd like.
All right, I'm not seeing anybody, so I'm going to hop over to the FMS room, but John, let me know if you need me to
Okay.
come back.
Sure will. Thanks. Okay, everybody, this is John Barry. Looks like we are all back. The person just came in, so the breakout rooms are closed. Thank you all for participating in that. And I will move us to the item of the report out that will come out of the breakout rooms, the IHSS subcommittee report out.
Thank you, John. This is Erin Thatcher. I'm going to do my best to summarize our rapid fire IHSS questions. So we had some general case management process questions and some intelligent ones, and I don't know, some doozies from IHSS land, but essentially I'd like to just share that Emily is still on leave. She will be back in part-time in May, and then hopefully by June, she'll be full-time again. So Christine Dos Santos and I are doing our best Emily Harvey impression. So if you have questions or things related to IHSS, please let us know. We also shared that there will be actually Danny's going to share a little bit about an upcoming rule process thing. So I won't talk about that, but we had the testimony for CFC, and I just want to thank Julie Riskin and David Bolin, who testified for CFC last Thursday, I think it was. A huge thing for our participant directed program. So thank you both. And then I think, let's see, what else?
Yeah, and that bill has gotten approved by appropriations this morning, I believe, and possibly second reading today. It still has to go through the House, but there's not going to be a problem.
Awesome. Oh, such great news. Let's see here. I think that's about it for IHSS, but essentially, if anyone has any issues or problems like Christine or I know, we'll put our contact info in the chat. And thank you all for participating in this breakout room. We appreciate it. All right, back to you, John.
Thank you. Was there something Danny was going to talk about, or did I misunderstand that? Was that some other point?
I think Danny's going to do an open forum comment mention.
Okay, I understand. All right, thanks. So, okay, speaking of which, we'll move into the open forum. And I described that earlier. Actually, before that, real quick, if there's anyone who's on the phone only who has not yet given their name for attendance, you can do that now. Anyone on the phone? Before I got Ron, Tracy, Renee, so those are all covered. Okay, hearing none. Let me take items for the second and final open forum. You can type your name in the chat. You can, Nathan, yes, I will put that attendance link in during the open forum again. Yep. Have Danny for the queue. You can raise your hand in the webinar if you want to get into the queue for the open forum. You can unmute your phone by pressing *6 and giving me your name if you like. Anyone else for the open forum? Okay, so we have Danny, we have Rebecca, Kelly Tobin. Okay, all right. As we have done in the past, we will start with the members, advocates, family members, and so on. And so, Kelly, please go ahead.
Hi there. In the breakout room, I was asking about the 15-minute rule in some FMSs, but not others. Like, will round down if an aide works, like, say, 4 hours and 7 minutes, they won't get paid for that 7 minutes. Or it apparently what I just learned is that if the aide works 8 minutes, then it's rounded up to 15. I just wonder where that came from, and if you know, I can see that state rule and why some FMSs do that and not others. Like, why can't the rule be changed such that just people get paid for, you know, every minute they do or don't? I mean, that they do work.
Erin, you want me to grab this? It's tied to the billing rules. You're muted.
So let me just say, we typically don't respond back in open forum. And since we have so many people, I don't know, John, I'm going to defer to you. I'm trying to stay within the guidelines of the meeting.
I was actually going to speak up. So Kelly, what we will do is you will get a response. This back and forth about this is not going to occur right now.
Sorry,
as per keeping
totally
how we
forgot.
run the open forum, but you will get, no, this is the perfect, you did the right thing. And to bring such an item up, we're going to get back to you in a way that is public, that other people will hear as well. So that's how we're going to handle that. Okay, thank you, Kelly. So now we will go to Rebecca.
Hey everyone, good afternoon. I just wanted to announce to the group some news. I will be leaving my position with PPL. My last day with PPL will be next Friday, May 5th. So I just wanted to announce it here just because I know there's a lot of folks who I know here who I've been working with for a long time, whether at Morning Sun or with PPL. I've been working in CDASS for a while. So I just wanted to make sure that the information got out to you all. And I'm sad to go. I'm going to miss everybody. And it's been an amazing experience working in CDASS. I've learned so much and I've got to work with some amazing people. So I'm very grateful for everything that I've gotten to do with CDASS and all the opportunities and all the great people I've gotten to work with and connect with. So thank you, everyone. I do want to say that Sandy Kasperzak and Ashley Young will continue to be points of contact for PPL. And we can definitely share their information again with the group if needed moving forward. And then any kind of staffing changes that happen in the future, you know, will be shared with the group as well. So thank you.
Thank you, Rebecca. Good luck to you. David Boland, I missed your hand before, but you are up next, sir, for the open forum. If you still have an item, unless I misunderstood that.
Now, I kind of wanted to go back, if I could, to the fact of, you know, people not being paid for like 7 minutes. That's against labor law. You have to pay workers for the work that they do. You just, under Medicaid rules, you have to be past 50% for billing, but that has nothing to do with somebody's pay. That's governed by labor law. And so, I mean, I've had many times when we couldn't bill a unit of service, but our employees all got paid for every minute they worked.
Okay, thank you, David. As I said before, we will respond to Kelly by sharing information. That's my understanding of what was just said. And it sounds like that's going to initiate a conversation, which probably be a good one to have. So we will, as a group, be coming back to this topic. So thanks. Let's see. Danny, you're up next.
I wanted to just let everyone know. I think a lot of people already are aware of case management redesign, and not going to pretend to be the expert on case management redesign. But I did want to give everyone a heads up that there will be changes to the regulations for the benefits and services within HCBS as that team is working towards waiver alignment and aligning regulations for everyone. At this point, it really seems like everything is going to be more of a formatting change. So the content and specific rules and requirements aren't necessarily changing, but the rule, like the formatting and structure of the regulations are expected to change. So with that, that could be of interest to some of this group, as CDASS and IHSS regulations are going to be a part of that. We do anticipate that those changes will be presented to the stakeholders early June. And so I think we'll be able to give you a better update of what's to come next month, but just wanted to put it on everyone's radar. And if you're interested in learning more about the rule alignment or case management redesign, I can put the link in the chat for that webpage. And I will also just read it out to the group for anyone on the phone who might be able to access the website at a later date or later time. The website is hicpuff.colorado.gov/case-management-redesign. And there you'll be able to find all the information about case management redesign, and Erin put link in the chat as well. More to come next month, though.
Okay, thanks, Sandy. Is there anyone else who had an item for the open forum, announcement, question for the group, anything? Okay, I am hearing none and seeing no other names. So with that, it brings us to the end of the agenda for today. We are meeting again next month on the 4th Wednesday. The recording for today's meeting will be posted online on the PDPPC webpage and also the link sent to you all by Friday of next week. Okay. Thanks, everybody. Have a great rest of your day. We will talk to you and see you very soon. Take care.